Okay, here's everything you want to know about breast implant massage. So the implant is here, and oftentimes the implant will be high early on, and the breast may even cascade over it. So what we want to do is, the idea is we're going to crisscross massage, so from the shoulder to the opposite hip. So I'm going to lift my hand up. I don't necessarily want to massage the breast tissue. I want to get on the implant, and I'm going to squeeze the implant to make it stretch the tissue here, and then I'm going to pass it back, and so it's 1 and 2 all the way to 10, and then I change my hand position, and again I want to get really high on the body wall, and if my nipple is low I want to lift my nipple up, and then I want to go 1, 2, and so when I bring this hand I will sweep the skin up, lifting the nipple up with me, and 1, 2, and 3 all the way to 10. So it's 10, 10, 10, 10. Breakfast, lunch, and dinner, and 2 snacks 5 times a day. Give you a total of 50 swipes. But again, we're not just massaging the breast tissue. We want to use the implant to stretch the base so that the breast gets to sit more evenly over the implant. If you have any questions, let me know.